A 2021 study uncovered a startling reality. Nearly 50% of people with diabetes are completely unaware they have it. That's about 240 million individuals worldwide. This is a critical issue to address because, when left untreated, diabetes can lead to severe health complications, including heart disease, vision problems, kidney damage, and nerve issues. Alarmingly, diabetes is linked to around 4.2 million deaths each year, with 1.5 million from cases that are undiagnosed or poorly managed. While many are aware of common symptoms like excessive thirst, frequent urination, and high blood sugar levels, there are numerous lesser-known signs that often go unnoticed until it's too late. Stay with us. We'll explore 12 surprising and often overlooked symptoms of diabetes. 1. Nausea. Nausea and vomiting are lesser-known symptoms of diabetes. They can arise due to neuropathy, where nerve damage slows the movement of food from the stomach to the intestines, a condition known as gastroparesis. This delay in digestion causes food to remain in the stomach longer, leading to nausea and, at times, vomiting. Elevated blood sugar levels can also contribute to nausea by increasing urination and dehydration, which exacerbates the overall feeling of unwellness. In more severe cases, diabetic ketoacidosis, a life-threatening complication of diabetes, can cause nausea, often accompanied by vomiting, abdominal pain, and other symptoms. Conversely, low blood sugar, hypoglycemia, can also trigger nausea, though it is more commonly associated with symptoms like shakiness, sweating, and confusion. Additionally, certain diabetes medications may list nausea as a side effect, further complicating symptom management for some patients. 2. Blurry vision. Changes in your vision might prompt a visit to the eye doctor, but they could also be an early indicator of diabetes. High blood sugar doesn't just affect your energy or weight. It can impact the fluid balance in your eyes, leading to swelling that causes blurry vision or difficulty focusing. Over time, uncontrolled diabetes increases your risk of serious eye conditions such as cataracts, glaucoma, and diabetic retinopathy. A study conducted between 2016 and 2017 revealed that 32.2% of adults aged 45 and older with diabetes were diagnosed with cataracts, a condition where the lens of the eye becomes clouded. 3. Nocturia. Nocturia, the frequent need to urinate during the night, is often overlooked as a symptom of diabetes. This condition arises when elevated blood sugar levels compel the body to expel excess glucose through urine. As a result, individuals with diabetes may experience disrupted sleep due to repeated nighttime bathroom trips. Nocturia may signal suboptimal blood sugar control, emphasizing the importance of regular blood sugar monitoring and mindful fluid intake, especially before bedtime. If nocturia persists despite these measures, consulting a healthcare provider is crucial to rule out other underlying causes. 4. Unexplained weight loss. Unexpected weight loss can be an early and surprising sign of diabetes, particularly if it's undiagnosed or poorly managed. This is commonly associated with type 1 diabetes or uncontrolled type 2 diabetes. The weight loss occurs because the body is unable to effectively utilize glucose for energy. As a result, it begins breaking down fat and muscle tissues to meet its energy demands. This not only leads to weight loss, but can also cause muscle atrophy, resulting in weakness. 5. Recurrent infections. Diabetes can weaken your immune system, making you more vulnerable to frequent illnesses. This can lead to recurrent infections, such as vaginal infections, yeast infections, bladder infections, and skin infections. High blood sugar levels impair the function of white blood cells, which are essential for fighting off infections. A 2023 systematic review of 5 studies revealed that diabetes is a notable risk factor for recurrent urinary tract infections, with E. coli identified as the most common causative pathogen in 4 out of 5 studies. 6. Pain in the limb. This can be diabetic neuropathy, a nerve damage that can cause significant discomfort in various parts of the body. This complication is often a result of prolonged high blood sugar levels, inflammation, and changes in blood vessels. The most common form, peripheral neuropathy, typically affects the hands and feet, causing burning sensations, tingling, or sharp, shooting pain. Proximal neuropathy, on the other hand, targets the thighs, hips, or buttocks, often leading to pain and muscle weakness in the legs. Focal neuropathy involves damage to specific nerves, resulting in localized pain, such as in the wrist, which may manifest as carpal tunnel syndrome. Lastly, autonomic neuropathy impacts nerves responsible for controlling involuntary bodily functions like heart rate and digestion, leading to symptoms such as digestive discomfort and other systemic issues. 7. Itching. Itchy skin is a common issue for people with diabetes, and it can arise from several factors. One primary cause is high blood sugar levels, which can lead to dry skin. This occurs because the body works to eliminate excess sugar through urine, which also depletes fluids. Without sufficient hydration, the skin becomes dry, irritated, and prone to itching. Additionally, diabetes can impair blood circulation, particularly in the small blood vessels that supply nutrients to the skin. Reduced circulation makes it difficult for the body to heal wounds and infections, leading to further skin complications such as fungal and bacterial infections. These infections are more prevalent with diabetes, as high blood sugar creates an ideal environment for fungi and bacteria to thrive. Persistent itching can be a sign that diabetes is not well managed. To help prevent and alleviate itching and other skin issues, it's crucial to maintain stable blood sugar levels, stay hydrated, and practice good skincare. 8. Darker skin on the neck. Darkened skin on the neck can sometimes be an unexpected sign of diabetes. It's a condition known as acanthosis nigricans. It causes certain areas of the skin, particularly in skin folds, to darken and feel velvety or thicker. While the neck is a common area for these dark patches, they may also appear in armpits, groin, elbows, and knees. Acanthosis nigricans is common in individuals with type 2 diabetes or prediabetes, and those with darker skin tones may be more prone to it. In type 2 diabetes or prediabetes, the body's cells become less responsive to insulin, prompting the pancreas to produce more insulin in an attempt to compensate. This increased insulin level in the bloodstream accelerates the production of skin cells, resulting in the darkened patches. Although acanthosis nigricans is associated with diabetes, it can also be triggered by factors such as obesity, hormonal imbalances, or certain medications. If you notice any unusual skin changes, it's crucial to consult a healthcare provider. 9. Night sweats. Excessive sweating during sleep, even in cool environments, are common for individuals with diabetes. This condition often points to nocturnal hypoglycemia or low blood sugar levels during the night. Such can result from factors like specific medications, intensive insulin therapy, irregular eating patterns, or engaging in strenuous physical activity before bedtime. Waking up drenched in sweat not only disrupts restful sleep, but also signals a dangerous glucose imbalance. To manage night sweats, it is essential to regularly monitor blood sugar levels, particularly at night. Adjustments in medication, diet, or activity levels should be made under the guidance of a healthcare professional. 10. Frequent nighttime thirst. Frequent nighttime thirst is common in individuals with diabetes, often signaling elevated blood sugar levels. This occurs because high glucose concentrations in the bloodstream draw water out of cells, prompting the kidneys to work harder to remove the excess sugar through urine. This leads to increased thirst and frequent urination during the night, disrupting their sleep. To manage nighttime thirst, regularly monitor glucose levels and make necessary adjustments to medications or insulin under the guidance of a healthcare professional. And it's helpful to balance fluid intake throughout the day to prevent excessive drinking at night, which can reduce sleep interruptions. Avoiding beverages that stimulate urine production, such as those containing caffeine or alcohol, can further alleviate nighttime thirst. 11. Dry mouth and dental problems. Dry mouth, medically known as xerostomia, is frequent for diabetics, primarily due to dehydration caused by excessive urination as the body works to expel excess glucose. Saliva plays a critical role in oral health by cleaning teeth and neutralizing acids produced by bacteria in the mouth. When saliva production is insufficient, it heightens the risk of dental cavities, gum infections, and other oral health complications. Elevated blood sugar levels create an ideal environment for the growth of bacteria and fungi in the mouth, exacerbating conditions such as gingivitis and periodontitis. These gum diseases can progress more rapidly and severely in people with poorly managed diabetes. To mitigate these risks, it's vital for individuals with diabetes to adopt oral care practices, including diligent blood sugar management, maintaining proper hydration, Regular dental checkups are essential for early detection and treatment of diabetes-related oral issues, ensuring better long-term health outcomes. 12. Fruity-smelling breath. Fruity-smelling breath is a lesser-known but significant symptom of diabetes, particularly when blood sugar levels become high. This odor, often compared to acetone or overripe fruit, is a hallmark of diabetic ketoacidosis, a severe and life-threatening complication. Diabetic ketoacidosis develops when the body lacks sufficient insulin, leading to dangerously elevated blood sugar levels. In the absence of insulin, the body cannot use glucose for energy. As a result, it begins breaking down fat as an alternative fuel source. This process generates ketones, acidic byproducts that can accumulate in the blood. When ketone levels become excessively high, the blood turns acidic, triggering the fruity breath odor. Thank you for watching. If you found this video helpful, don't forget to subscribe to the channel and share it with anyone who might benefit. See you in the next video.